Thank you and welcome. I'm by the name Agri Kevin, and I'm going to talk about importance of health literacy. So, in the outline, I'm going to talk about the definition of health literacy, the health literacy cycle. I talk a bit about the importance and the intervention to improve the health outcomes, and then I'm going to conclude. So, what's health literacy? Health literacy is the degree of which an individual have their capacity to obtain, process, and understand basic information and services needed to make appropriate healthy decisions. So this means that if one is able to obtain, you know all the processes that you go, you understand some basic information about and services that you need to make good decision about health, then we can say you are health literate. So it also depends on individual and systematic factors like communication, culture, availability of services, and so many others. So why is being health literacy important is what we are going to look at. The first thing is about accessing healthcare services. So when you know all those things, you are able to access health services that you need. And analyzing relative risks and benefits, you are able to analyze that this might cause this, and what are the benefits or what are the gains that you can get from something. Calculating dosage, you use in calculating the dosage maybe that you have been given by doctor or a prescription from the doctor. Communicating with healthcare providers. This means that you are able to know how to communicate effectively with the healthcare provided. Maybe when you want to ask for services or a certain clarification of certain issues, then it can help you so much. Evaluate information for credibility and quality. Sometimes there is where you need to check the credibility of maybe services and the quality. If you are literate enough, you can able to distinguish that this service is credible and it's of high quality. Interpret the test result and locate health information. For interpret test result, it means that you are able to read and understand the outcomes of a test and maybe figure out whether the results are good, positive, or negative. In other terms, locate health information on the other hand means that you are able to know this information is good for me. It's an health information that I need, and so on. So let's move on the challenges. We have seen that even though some people may be literate when it comes to health, but there are some challenges that they may encounter. One, when one is not familiar with medical terms and how their bodies work. So when you are not aware about familiar with medical terms like for instance prescription terms, like those medical terms which are used like health inequalities, what and what. So when you are not familiar, it is really a challenge when one has to interpret the number or the risk to make in a healthcare decision. When to interpret numbers, it can be challenging to maybe figure out like demographic figures of a certain disease like malaria. If you are not really literate enough, it can be challenging. When one is diagnosed with a serious illness and scared or confused, so sometimes there are some diseases when you are diagnosed that you are suffering from such diseases, it becomes hard for you to figure out those issues related to maybe locating health information and so on. When one has a complex condition, that required complicated self-care. Sometimes there are services someone can be literate here, but there are some services that you require that you may not have much information about them. So let's move to impact of low health literacy. So here we are looking at how it can impact individuals with limited health resources reported of poor health status. Yeah, let's talk of like nutrition. In order to make a good decision about nutrition decisions, you need to know the kind of food you take, the quantity and the quality that is needed for your body. You don't take much, for instance, fats and carbohydrates, which can lead to obesity. Cancer screening information may be ineffective as patients may diagnosed with later stage. This is why I find that people don't go for checkups, they don't go to check themselves. After they realize they are sick is when they are when you find that some cancers are at the last stage where it is very difficult to handle the problem. Inadequate health treatments may contribute to this appropriate burden of diabetes-related problem. This is what we talked about. People do not have much information about certain diseases, maybe the way they cause agents, and maybe the way they can avoid them. Low health literacy impact the economy negatively, as we have seen that when people have they are not having much information about these things, about diseases control. For instance, a given place whereby an outbreak can come, people do not know how to handle the spread. Maybe for instance Ebola, they are contaminating with other people, they are moving, so it can affect the economy because the government or they may require to mobilize more resources towards preventing those diseases or controlling them. Limited health literacy hinders preventive care. As we said, preventive care like people suffering, let's say, terminally ill patients of cancer, they need a lot of care, they need a lot of tension, whereby you need to help them to understand some of other things, the services they need, like palliative care, what they require. So when you are not literate enough, it can hinder it can hinder or affect even other people. Coming here, we are looking at these are some of the impacts or the results that are brought by poor health literacy or low health literacy. We find that they are more likely to visit an emergency room, have hospital to stay. Patients with this low health literacy are less to follow treatment plans. This is very significant because if you don't follow the treatment plans, it can lead to a more higher mortality rate. The death rate increases because of that. So let's move on health scale. So these patients, the people are being graded in different. They have been graded in different scale. The first one, as you can see, we have provisions. Those people who are able to perform complex activities, they are provisioned. They can perform health complex activities. We have intermediate. They are able also capable of conducting moderate, challenging tasks, like those tasks which are moderately challenging. We have PESC in the scale who are able to complete simple tasks, and we have below average. Those who can the lowest level of performance. Those are below average. So, moving on, this is a sample of a graph showing health literacy in the United States. So, as you can see from the graph, there are some figures you see, like those with PESC. We have below PESC, intermediate, and proficient. You know, less than the high school, you can see the number. High graduates, you see, and other college attendance or degree, you can see, and bachelor degree, you can see. As you have seen those from the graph, if I try to interpret, you can see those who are less than high school, they didn't finish high school, they have the higher number of below average. They cannot able to complete even some simple tasks. Graduates, however, they are intermediate. They can be able to do some challenging tasks and so on. So those who from colleges and degree, most of them they are in the 65%. That's intermediate. Sorry. So for bachelor degree, you find that most of them they are intermediate, and we have a good number, 9% who are in proficient. That's a graph showing some research. Intervention to improve the healthy literacy, we found that it provides literacy education. Try to provide education to the people about health issues so that they can be able to have knowledge. Improve health-related knowledge. This is the knowledge that talks more about healthy and health-related issues, maybe about the diseases, disease control, and what. Improve adherence to treatment. So adherence, people, this means that you improve the way people are given services, they are adhering to treatment plans, and so on. Improve patient-provider communications. Because we have seen communication is also a leading factor that is affecting low health literacy. So it's good that to foster good communication so that whenever patients have problem, they can know how they can communicate with health care provider. Improve mental health. Mental health also contributes a lot because mental health involves things called like stress management, depression, and so on. Increase patient satisfaction. It's like try to increase the satisfaction of some services from the patient. This also has small graph showing a framework. You can see this is literacy, health context, individuals, and outcomes. This is trying to show us the framework in which and how health literacy looks like. These individuals who are infected, this health context, we have health outcomes and cost. So in conclusion, we talked about health literacy. It's a degree in which a person can obtain a capacity to obtain a process and understand basic health information, services needed to make appropriate decisions, as we have seen. So we have also seen that interventions aims at closing the gap of low health literacy in promoting health care. This goes by showing that we need to do some interventions. We need to work in order to close the gap because, as we have seen, it has a lot of impact to health care. So this is where the information was retrieved on, and this also another one. So thank you very much, and I wish the information that we have shared it's going to help to change and everything and help you to improve on matters concerning health literacy. Thank you very much, and Hope to see you next time. Thank you.